I'm from Wolfboro. I think my son wants to say something first.
Hi. Thank you.
You're welcome.
I've not been into politics for a long time. Really, just the thought of politics made me break out in hives. And it was really finding or discovering you that I've become a huge supporter and advocate of your message. And I completely agree with the Department of Education abolishing it, getting rid of it. My question is, on the state level, for children that have disabilities, I have a son that has an IEP that has an educational disability. So my question is, how would children that have those disabilities that need that extra help in schools, how would they be protected if IDEA is not available?
Well, under the Constitution, it would be handled at the state level. There are federal programs, but you know, there's a federal program right now that they've been testing, and it's rather frightening. It was this mental health testing, you know, to make sure that no child in the country would fall between the cracks, and they do this mental health testing, and they found out on the test about 20% of them were put on these drugs that are supposed to help people. So I don't like the idea of Washington, D.C. doing it, because they are going to encourage more drug usage. But an honest question about how do problems like this get solved in a free society? The one thing I know, when you're in an unfree society and you see the results of what we have today, we're all a lot poorer. So they're going to have a tougher time. So the solution of government being there to always provide the care isn't the answer at all. But also, I address this when I talk about the transition. You know, I know exactly the way we should have done it, and we could have done it better, whether it's anything from Medicaid, insurance, or whatever. But if we end up where we are working our way out of it, which is what my argument is, that you cut things like the Department of Education, Department of Energy, and the military, and cut down, and then what you do is you try to take care of the people that we were taught to be dependent on. So if there's child health care, or if there's the elderly that have become dependent, I'm not going to start there. You know, maybe someday we can have a better system. But in the meantime, you ought to cut, take care of the people who are very dependent. And also, though, one of the transitions that I would like to see, even under Social Security, if we did enough cutting, we could. And that is let young people opt out of it. We talk about opting out of Obamacare. Why don't we opt out of Medicare and you know, Social Security as well? So that's probably not a perfect answer, but a transition that would be able to do that. But just think about it in a free and prosperous society. There's still a lot of charity in this country, and we sort of, and that's going to be diminished the poorer we get. I have a hospital. There's a burn hospital in Galveston, Texas. And any child can be brought there and they don't have to pay anything. Even in spite of all these economic problems, these things still do exist. I think it was a tragedy that we went from church hospitals to government hospitals. Church hospitals, you always paid the least. Today, everybody pays the most. You know, everybody gets put on another program. So it's a bad system, and that's why some of these programs come up short.